Okay, we've got one commissioner that's spending a minute over at Pate Transportation. He knows he's supposed to be here. He'll be here shortly. We're going to go ahead and get started. If you will, let's stand and we'll begin with a prayer and our Pledge of Allegiance. Heavenly Father, we thank you for this beautiful fall day. We thank you for giving us the chance to take care of county business. We pray you give us the wisdom and direction in this meeting to make these changes that are important to every single employee and family member. Lord, may we do what is in the best interest of all concerned and use wise and discerning choices as provided by you. We ask for your blessing on us the rest of this weekend, and may we always look to you for guidance in every facet of our lives. It's in Christ's name that we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, Luke. Morning. Item number 1 is public comments and or requests for information on non-agenda items in accordance with Section 551.042 of the Texas Open Meetings Act. Does anyone have a public comment they'd like to make before we begin with our main single solo item? All right, we'll move on to item number 2. Consider and possibly approve changes to the employee health plan for the 2014 calendar year. We talked about a lot of things in our meeting last week, and many of these are relatively easy decisions we have to make today. We have some bigger decisions that will not have to be made today that we can make at a later time. We may bring those up for further discussion today, and we even have at least a couple of things that we did not talk about last week that CAPS Insurance realized really needed to be addressed at this time. So, why don't, Tony, do you want to come and take a seat at the table? Do you want to stand up there at the podium? Why don't you, and if you want to take Carl's spot down there, that would be fine. There's no point in standing. No, there's no point in standing up. Sit down and be comfortable.
No, just have him stand up.
Al, do you have a copy of this document here? Yes, he does. Okay. Here's where I tried to summarize for you the things that I think we need to take care of today.
Tony, can you pull that mic a little bit closer to you?
There you go. Yeah, it's ready.
So you want me to just guide on it, or you want?
Yeah, if you want to use my notes there as a guide, if you want to use your own, that's fine. I just tried to put everything that I had caught the other day to write it down, just to remind us of what the decision is that we need to make today.
Okay. Yeah, and that's good. We'll just go with this, and then I'll add as a point second into your second or your first tier thing. The first thing is a voluntary vision plan that we had suggested that you offer your employees. Would be totally at the discretion of the employee to purchase it. You would give them coverage for materials like frames and lenses that are currently not covered on your health plan now.
And run down what is covered related to vision that is covered in our plan if they were to make no additional purchase of a vision plan.
They have a basic vision exam benefit that we did discuss in the workshop needs to be implemented to have a refraction coverage, meaning to take you if you're far-sighted or nearsighted when you have that exam benefit. So if they didn't purchase the voluntary vision plan, they would still have exam coverage to go get their eyes checked, and that would be for reason or for just GP classes.
We're just starting, and I thought that 8:30 might throw you.
I'm calling myself looking at that.
We're just starting. We're on item number 1. We're back talking about the vision plan. But Tony, to clarify, if you just simply went to the doctor and said, you know, it's time for me to move up from my readers and get some real glasses, I need to have my vision checked to measure me for glasses, that's not covered with our basic medical policy. If it's, I've got a red eye and I need to go see the doctor and find out what's the matter with it, that kind of situation would be covered.
Correct. Or if you have cataracts or glaucoma, a medical condition is covered. If you just wanted to use your vision benefit that you have to see if you need glasses, that's not covered. But we were suggesting you add that to that vision benefit.
Mm-hmm. At the cost of the employee.
Well,
and
no, add the refraction benefit.
Oh, add the refraction only benefit,
Yes.
not buying of the glasses and the contacts.
Correct. And then we added the voluntary materials package, which would also let them cover their dependents. You know, if they chose that benefit, I mean, not everybody wants that benefit, but that would be at the discretion of the employee if they purchase it or not.
And our current policy, excuse me, let's talk about a year ago, our Health First policy. How did it handle these situations?
Apparently exactly the same if we copied that. Moving to doing more.
Okay.
We just copied that benefit.
So if we were to add this refraction coverage, it would be enhancing our existing and previous plan.
Very little cost. Very little cost.
Can you quantify very little cost?
Chris Kavanagh said that less than a 0.5% of your overall cost, which would be, if you go to the doctor now, it costs about an average $75 for a vision exam. That includes everything that you're doing now, plus that refraction. You're probably doing about $50 of that now, so maybe an additional $25 to have somebody's near and far-sighted vision check.
Wait a minute, 25 and 50? 25 to 50 is, and you say it's a 0.5%?
Well, I'm talking about your overall cost. I mean, if you don't want to do it, don't add it, because you've never had it before. I'm saying that is about, there's no way to quantify that, because we don't know how many people are going to go to the doctor. I'm saying it's cost about $75 now when you go to the doctor and have your eyes checked. Isn't that about right? It's what I pay. So if someone's going to the doctor now and just getting the exam only, you're probably paying about $50. They're paying their copay for it, so they're paying $25 of it. Isn't that what your copay is?
Yeah.
Yeah.
But the doctor, again, would have to split out that charge into what is medical exam and what is...
At this point, they're probably billing your people for doing it. Because I guarantee you, the doctor's doing that when they go to get their eyes checked. And the people are probably just paying for it. I've never had anybody tell me that.
I mean, I'm not. I started wearing glasses 20 years ago.
And they...
Have you had a big yours?
I followed my wellness and I didn't pay anything for my exam. Now I pay for my glasses.
And it's saying, even if they're just saying that that's that doctor may be saying that's a wellness system, then that's paying 100%.
I think that's the way we did it on the wellness.
That's the way I've done it.
That's the way the doctor files the claim. If the doctor files the claim not as a wellness benefit, then it won't be paid that way.
Right.
If he's paying, if you go and you say, I need glasses, check and see if I'm farsighted or nearsighted, then they're probably having to pay. I don't know. All I know is Chris Kavanagh said that it's not in your current benefit now. The coverage and cover refraction to see if you are near or farsighted.
Refraction, you talking about laser?
No, I'm talking about to see if you need glasses.
Oh, okay.
Just taking the measurements at the ophthalmologist's office to see if you need glasses or to see if you need to change your prescription. That technically is not covered. Whether it slips by as a wellness issue and gets paid by the plan, I don't know.
You know, the way around this, if you don't want to make a change to your current benefit, you offer the voluntary plan because it'll cover it. It'll cover that. If they want to purchase it, they buy it on their own.
Okay. That would be my preference.
That, I guess, is what you all need to decide what you're going to do.
And so we need to address this before we talk about adding a employee paid vision plan. Anybody have a question on the issue at hand? Do we add a clause to the plan that will pay for the employee's doctor visit to measure them for glasses needs, which is not currently covered under our plan, nor was it covered under the Health First plan?
If I remember right, we covered that under the Health First by the wellness thing, by the wellness deal. It seemed like, if I remember right.
Do you all remember any personal experience getting glasses?
I've never had any, but
I haven't. I went and had mine checked and everything, and then I just was reimbursed by Health First for mine. I paid, and I just paid.
But they reimbursed.
But they reimbursed you for it.
But you had to file. You had to file a claim. The doctor didn't file it for you. Okay.
Did you ask him to, or is that just something?
No, I didn't.
You just paid.
I just paid it.
Okay. What would you like to do? Got a lot of things more pressing than this.
When you say 0.5%, is that 0.5% of our total bill?
Probably 0.5% of the actual charge of the vision. She did not clarify that for me. So whatever the doctor would charge or something, I'm assuming it would be probably around a $25 benefit for whoever would go to the doctor and say, I want to have my eyes checked to see if I need glasses. If you're just going to go to the doctor to just say, I haven't been to the doctor in forever, you might file it as a preventive claim, and then you wouldn't have that.
It's time for my annual exam to have my eyes checked for diseases, glasses, whatever the case may be.
Again, in everything y'all do, it's determined by how the doctor files the claim, and this is no exception.
And how would that affect the premium to our policy?
Probably very little. I cannot tell you that because I don't know how many people are going to utilize this benefit. Again, if you want to keep it the same, keep it exactly as it is, have a voluntary plan, and then cover that vision done. If you've not had a lot of issues with it in the past, maybe it's not a big issue. That's what I'm just saying. I mean, we didn't know that this was even written this way until the last workshop.
Do we need to make a motion on this?
I think we should on each one rather than, because we're going to have a variety of opinions on each one of these, and so we probably ought to address and vote on each one of these individually.
I sure don't have a problem leaving it just like it is, but also I don't have a problem if the employee wants to get this additional plan, they can.
That's what I was going to make a motion to do that, to leave the plan as is, but if they want additional, they can do it themselves. They can purchase it themselves.
Okay. Got a motion, Tony, to leave the plan as it is right now, not make any alterations. I have a second. Second by Commissioner Fields. The motion was by Commissioner Hockaday. All in favor of leaving the vision plan as it is with our current plan alone, not making any changes. All in favor say aye.
Aye.
Aye, and that's what we'll do, no change. Okay, now you want to talk about adding employee paid optional vision package.
Correct. This would be with the same carrier that would be providing the life insurance, so it would be easy for the auditor's office to administer this. It would be offered at the open enrollment at the same time that health is enrolled. It's just truly, if they want to pay it, they pay it. If they don't, they don't. They can cover different people than what they're covering on their health plan. No cost to them.
This is strictly the individual doing this.
Strictly the individual that can cover themselves, their family, their kids, their spouse. And that will cover glasses, the actual exam, whether it's preventative or contacts.
And it sounded, as I wrote down, what appeared to be the consensus was that we would go with plan number 4, which allowed for 3 local providers to be included in that, and that was Dr. Lawler, Dr. who else?
Nichols. And the new folks that are, not Pleasant Associates. They're in the old Verizon building. Domino's portion. Yeah.
Okay. Lawler, Nichols, and the new folks in the old Verizon building. All right. And plan number 4 was, what was unique about that one? That
well, it's with VSP. VSP is a nationwide provider. If they choose not to go to a provider in Mount Pleasant, there's a lot of other providers within this area. Wherever they choose to go, they'll have providers available. It is a $10 exam copay, $25 material copay that will cover the frames, the lenses. Again, cosmetic things are in addition to that. Cosmetic things meaning tinting, UV, scratch proofing, those things that they ask you to want when you're at the doctor's office. So that will be in addition to the $25. They can get an exam every year. They can get lenses every year. They can get frames every 2 years.
okay. I think we were all pretty well in agreement on that. If you need any refresher, I've got that information here. This was the one that was a proposal for guardian group benefits in sync with innovative solutions. And the odd numbered plans 1 and 3 included retirees, and plans 2 and 4 did not. So at this time, we're not making any changes to the retirees today, I don't believe. So does that mean we need to go with plan number 3?
I would assume you meant 4, because
I thought the other day that's kind of what we decided on was plan 4.
Well, but that did not include retirees, correct?
Right.
That's right. This is a voluntary benefit. I'm getting confused.
Voluntary.
Sorry about that. Plan number 4. All right. Well, I'm gonna make a motion that we offer plan number 4 of the vision package that would be an employee paid for benefit.
Second.
Second by Commissioner Fields. All in favor of going with the Guardian Vision Plan number 4. Say aye.
Aye.
Okay. Okay, next that I have on, you keep going, I'll let you lead.
Yeah, and this is really not really an action item. I just wanted to bring to your y'all's attention that there was a program called Compass that would let the folks be able to find the lowest cost service they could if they were having service done. I think y'all pretty much decided that y'all's benefits are awesome and already very low. This is a service that a lot of times people use when the deductible's higher, when you have more out of pocket for the individual. So, I mean, I'm not even sure that this even requires a judge. I mean,
Well, to put it in cost perspective, it's $4.50 a month per employee. So we're talking about $50 per year per employee to provide a low-cost search software and program where employees could search out where the lowest cost on the type of service that they needed. And we felt like it would probably not get utilized enough to justify that $50 per employee per year. So therefore, I'm going to make a motion that we pass and do not utilize the Compass option.
Second.
Second by Commissioner Hinton. All in favor of not utilizing the Compass option, say aye.
Aye.
Opposed? Okay.
the dental plan, there was a couple of different options suggested. I actually suggested that you incorporate a rollover benefit. which would, a lot of times people will have a dental plan and they just go get their teeth checked, but they don't have an issue, and then when they do have a problem, the annual maximum is not enough to pay for whatever their problem is. So the first alternative would be to have this rollover benefit, which Chris did say that they could implement, which would be if someone goes to the dentist at least once in a 12-month period and does not go over the threshold amount of $250 during that calendar year, then the next year some money would roll into that rollover account for them until the rollover amount meets the maximum. As opposed to that, if you didn't want to do that, you could increase your annual maximum if you wanted to make it easier. Those are your two alternatives.
But they have to go at least one time a year. I can't go 5 years without going to the dentist and then show up and get all my problems fixed.
You have to go at least once a year, have your teeth cleaned, have that exam, just to kind of make sure that everything's good. That's one of the caveats of the rollover.
And our annual amount is $250?
No, your annual maximum now is $1,000.
$1,000, okay.
No, I'm saying if you implemented a rollover account, you possibly wanted to think about maybe adding $250 a year into your rollover account, reaching another amount. That might be too much to deal with. It might be easier to just add a little bit of the benefit, because I think the general consensus was y'all thought your dental plan were very good. If you wanted to add some to the annual maximum, again, now's the time to do it. If not, then we leave it alone.
I think I just think to raise the maximum up to $1,250 and not mess with this part right here.
The rollover, but just
rollover part.
Well, what you run into is somebody has a root canal or a cap, and usually your checkups, x-rays, those type things, you're probably looking around 100, 125, those type things. And if you have something major, most of the time, you're just looking at, just the basics. But if you do have something come up there, and right now, I think everybody's in pretty good shape. Really encourage people to use this dental plan, and I think it's really leveled off, and actually the expense is really went down because people have been using this benefit. And I don't have any problem with just going up, and if you had something major that year, because the next year it may be down $250, $300. I don't think anybody goes to the dentist just to be going. That's something that I don't like to do anyway, but I know it needs to be done.
I think it's fine where it is. I'll entertain a motion when you're ready.
What does this do to the premium? Does it affect the premium?
No.
Well, again, we got to quit thinking about insurance premiums and what is the insurance company going to charge you. Look at it as the county is picking up all these expenses.
If we go up to $250, we're responsible for the additional $250.
Say again.
If we raise it from $1,000 to $1,250, that's
The county will pay that additional $250 for everybody that goes over $1,000. The county will pick it up.
I think we need to add a little bit to it. It may not be $250. Let's go $1,200. I'll make a motion that we raise our max to $1,200.
Motion by Commissioner Fields to raise the annual maximum of the dental coverage without rollover from $1,000 to $1,200.
Second.
Second by Commissioner Hinton. All in favor, say aye.
Aye.
No. Okay, 3-2 on that one. So we will change the dental plan up to $1,200, Tony, but no rollover.
The next issue that I had was your retail versus mail order drug but you have to pay 3 co-pays to get a 90-day supply. So there's no incentive for anyone to use it. I actually got a pharmacy report yesterday, and it says that you had absolutely 0 people use a mail order benefit. And there's nothing in this bottom box. Okay? The thought was made during the last meeting that if you had a mail order plan that was the person paying either 2 co-pays or 2.5 co-pays for a 3-month supply, that would help your utilization. Right now, your drug utilization is pretty high. 131,000 just in prescriptions filled. All of those, you know, who knows how much they cost. But if you are actually utilizing a mail order program, not everyone's going to use it, but at least it would be available for those that chose to do it with a little bit of a price difference. I know also the thought was raised that if you do that for mail orders, you want to do that for local. The PBM, which is the pharmacy benefit manager, will do that, but you lose discounts doing that because you're going to be literally paying for 1 month free. You're not asking any copay for that if you choose to do that at the local level. So, to kind of summarize this, I guess you need to decide, are you going to incentivize folks to use a mail order benefit by only having it be a 2 or 2.5 times copay?
Okay. Here's my thoughts on that. And it's important that we understand this, because if you go with a mail order, the difference to the employee, for example, if I have a $25 a month prescription and I want to get 3 months worth, I'm going to pay $75 right now as it is. Now that drug may actually cost
$5,000. It could cost anything.
Good example. In my case, it might be $100 a month instead of $25, so it might be $300. So I'm paying $75. The county's paying $225. Now, if we get it mail order, maybe that same prescription is $200. I still pay, instead of $75, you now only charge me $50 for paying 2 months copay, and you give me 3 months. So it costs the county the difference between $200, the discounted mail order price, and the $50 that I paid. It now costs us what's that? $150.
Actually, with this report, your average prescription, and this is the average year-to-date prescription that the county paid, was $92.61. The member paid $13.19.
So you're exempt for those?
Yes. So if you are, with the mail order, the discounts are deeper than what you are utilizing at the local level.
And so the point is, I certainly would not want to offer that discount of shaving off a half month or a month if they're going to still buy local and pay the retail price. Then again, if I allow it for mail order, then I may be steering away from my local vendors. Just so you understand that difference. But again, you've got to keep in mind, every move that you make may produce a little bit of savings to the employee, but it may end up costing the county a lot more, as in this example here.
The PBM manager yesterday told me that on average, your size should be having about 10 to 12% utilization of the mail order, and that's the norm. So it's not going to be where 75% or half of it's going to go to a mail order, but 10 to 12% of your people will utilize the mail order if it's incentivized for them to do so. On maintenance drugs. Sure.
And there's a lot of folks that are on a regular, once a day medicine, blood pressure, cholesterol, whatever, okay, diabetes.
The diabetes, the blood pressure, all this is involved in it. But at the same time, you know, I look at the mail order, I think if you can buy medicine for 90 days, you're going to get a little discount of some type because you're buying more, so they can give you a little bit better discount. But at the same time, you look at our local pharmacy that work here, they pay taxes here. And, you know, I want to encourage people to use our local pharmacy, but if they can get a better discount, and, you know, it comes back to checking prices. You can go right here in town and you can go to different pharmacy and ask, what does this cost here? And there's some of them pretty good price difference.
Well, they're going to tell you $25. And not all employees are going to go to the trouble to set up a mail order account. So not everybody's going to flock to mail order. You're going to lose some people, and our local vendors are going to lose some business. So my opinion is you offer 2.5 times only for mail order, and you do lose some local business, but the county ends up with some pretty significant savings, because I think those discounts that the mail order drug will cost the county will be significant.
Yes, I get all my drugs mail order. It's no problem once you get it set up.
Once you get it set up.
The first time, I mean, after that, it's just renewing the prescription. Nothing to it. They call me. Time to renew.
Well, Judge,
And it saves a lot of money, though. Not a little bit of money, Terry. I mean, it's a lot of money. The difference in the cost.
If you were to buy it local versus buying it mail order.
Like half or less. That's the savings.
And that's all going to be county savings.
Yeah. It's just not significant.
Okay. Any more questions, comments?
I don't have a problem going with the 90 days mail order. I think instead of 2.5, I think we need to do 65. That's a $10 saving to the person that's doing it.
Is that going to what now?
Instead of 2.5, do 65. That would be
Go to $65. Well, we need to express that as a percentage, because not all of your drugs are $25. The more expensive ones are what, 50?
Yeah.
Some of them are 5.
Yeah.
Why don't you just go to the,
If you do it,
why don't you go to this two co-pays on it?
50 instead of 60.
Yeah,
Or
Just 2 co-pays.
It's 2 co-pays.
Because some of,
yeah, you do it times your copay.
Yeah.
And because if you go out in generic, it would be, you know.
$10.
Yeah.
Well, that gives them enough incentive to go, hey, I need to look at this.
Yeah.
I can save $25 here, and then the savings to the county can be
Way tremendous.
$200.
Yeah.
Well, that's how we incentivize them. That would be my motion, is that we offer 3-month prescription for the cost of 2 for mail order prescriptions only.
I second that.
Second by Commissioner Hockaday. All in favor, or any other discussion before I rush you? All in favor of that proposal, say aye.
Aye.
You know, I don't have a problem with that. I have a problem with our local people not being able to supply the drugs for a 90-day.
And I completely understand you.
One thing that might be able to do, Mike, because I'm sure they're running into this with all kinds of plans, maybe there's a way for the local pharmacies to be an intermediary, run it through them, where they don't lose the whole business. They may not make as much money on the business, but they may be able to, you may be able to just call the mail directly, each pharmacist call the mail for you, still run it. I don't know that, but that's.
And you can still go to the pharmacist and say, you know what, I'm going to pay 3 times because I want to give my money locally. Well, it's cost you $25. You've given some money to your local vendor, but you've cost the county $100, $150, $200. It is a trade-off. That's a good point, Mike. But my job today is to look out for the county.
Well, what I'm looking at, Judge, is we have local businesses and they pay taxes here.
And I think that I'm not expecting this to be a huge impact on our local vendors. I'm hoping that it's not.
Okay. I really don't know. Do you have any ideas that,
Well, he said 10 to 12% of people will utilize the mail order program. So if you got 125 people, that's 12 people.
All right, I'm going to call the vote. I've got a motion and a second. All in favor of this? Again, 2 months pay for 3 months medicine for mail order drugs. All in favor say aye.
Aye.
Opposed?
no?
Okay, I've got one no. Okay, Tony?
All right, it's been suggested that your shingle shot for folks over age 60 be paid as a preventive benefit. Right now, the way it's been done is you have to get a prescription from the doctor to go to the pharmacy to buy the medication and then take it back to the doctor to get the shot done. This would basically make this be at no cost benefit for the employees.
And right now, it'd be costing $30 on something, $20 for the doctor, $5 for
The cost of the medication plus the code.
right, it'd be $30. That would be $30 that they wouldn't be paying. The county would be paying.
This is just for the shingle shot?
Right now, you're looking at, if you get the shingles, in my understanding, the shot has worked well for people that's took that, you're looking at anywhere from $3,000 to $6,000, depending on how bad the case is. I think that would be a great benefit for the employees and really cut the cost if somebody does have the shingles.
What are you saying, it costs $3,000, the shot itself costs?
I'm talking about the treatment and taking care of and going through the shingles and going see it.
If you didn't take the shot and you got the shot.
Right.
All the doctors told my wife that there's no cure for it after you get it. They give you something for the pain, that's about all they give you.
Well, it's a miserable 2 weeks, I hear.
Hers was about 4 weeks.
4
longer,
weeks.
Yeah.
But this shot supposedly
Everybody that I've talked to that's had the shot, they have not had the shingles, so.
All right. Would you like to do this?
I'd make that motion.
Motion by Commissioner Fields that we include the shingle shot as 100% paid preventative. Second by,
Is that over 60? Over 60 years of age?
I don't know, is that defined as over 60 years of age?
It's only people that can get the shingle shot.
Yeah.
Okay.
Yeah, 60. If you're 60.
They won't give them to young guys like me.
I guess not.
Right. Yeah, you're not eligible. I've got a motion. Second by Commissioner Hockaday. All in favor of the county picking up the tab on this shingle shot as 100% paid preventative for those over 60, say aye.
Aye.
Aye. Unanimous. Thank you.
Okay, 2 things that are not on y'all's list is, and that have to be discussed, is due to changes in the Affordable Care Act, you are required to have a 4th tier on your RX plan for specialty drugs. Specialty drugs are those very, 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 very expensive things that are maybe $1,000, $2,000, $5,000 a month. Injectables, things for local, like MS, AIDS, that kind of thing. Currently, I think y'all that were here last week or whatever that was, Chris said there's nobody that's currently taking these drugs now, but you do have to establish a copay for it. And I gave you the printout. What is she suggesting that we use? A max of up to, it's 10% up to a max of 150?
I think that's correct. I do not, I left it in the truck. I did not get it.
Does this include, are these cancer drugs too? Oh.
You know, I don't have a list of what is on specialty because formulary is being reworked.
Okay.
But this would be new drugs. There's
Something that'll be rarely used here.
Well, there is something that apparently there's a new drug called Vitoza, VTOZA. It's a diabetes injectable drug that is brand new and it's around $2,000 or $3,000 a month. That would be in that specialty tier, but at this point point, nobody's taking it. And they're just, the cost is just exorbitant. And but the suggestion was to do where nobody's paying more than $150 a month, but that would increase the copay that your people would pay if they had such a drug.
So we'd go from, I'm sorry, go ahead.
No, go ahead. I thought
Generic,
Brand,
brand, non-formulary, and this new one that we've never had before. We just have to define it, and instead of the $5, $25, and $50, this becomes a new
yeah,
level.
it would be, I think it was 10% to a max of $150 per month per employee.
150 is as high as you can go.
Yes.
Oh.
Yes.
And did you say this was mandatory?
Yes. This is not a, you can do it or not. Yeah.
All you're deciding is how much of it do you want to pay. You want to say it's a 50, a 75, or you want to go all the way to the 150 maximum?
Correct. It was Cochran's recommendation to do 10% of the cost of drug up to a max of $150 per month per employee.
I like that.
Judge, since at this time we have nobody on these specialty drugs, I don't mind setting it at 150.
Okay, put that in motion.
Yes, sir.
Comment?
I was just going to say, if it's only $1,000, though, if you did 10%, I mean, that might
be 100.
Easier on people. But I mean, whatever you want to do, it's up to you.
I like the simplicity of 150. Motion by Commissioner Fields to establish a maximum out-of-pocket of $150 per month on Tier 4 drugs.
I second.
Second by Commissioner Hockaday. All in favor, say aye.
Aye.
Aye. Opposed, and there are none. Okay.
Okay. The other thing that's not on your agenda item is dependent life. And does anybody still have the life proposal? Y'all still have that?
Which one is it? I got so many of them up here.
Well, let me just, it's pretty easy. Basically, when your life policy was first started, I was here, because it was a long time ago, but I'm assuming that you had a dependent life, an employer-paid dependent life option. Usually that's the way dependent life works, if you've got just this benefit. What this benefit is, any employee that has a spouse or has a child, they have a $5,000 benefit on the spouse and $2,500 benefit on the children. Okay? That is costing $1.68, which, again, I'm assuming when this started, that was paid by the county. Now, that is considered a voluntary thing.
I think it's a voluntary from day one.
Okay. But you only have 16 people on it. 16 units is what is on the proposal. They're paying that themselves. You've got a couple of different options to do. My suggestion is that you grandfather the people that are on this, let them keep it if they want it, continue to pay the $168, but don't offer it in any form or fashion to your new people, because you now have a voluntary life plan where they can buy $10,000 on a child, and I forget now, $25,000 on a spouse, and $100,000 on themselves. So they've got the avenue to buy a much better plan now. But you don't have to take that recommendation. You can continue to offer this at $1.68 a unit, but it would be an accounting, another line item for this to do with. So, does that make sense? No.
We're not accounting for it now.
Yeah, you are.
That's what it says, so
Yeah. My thought is to have it just let people keep it that have it, but don't offer it going forward.
Judge, I don't have a problem with that because it grandfathers it in. These people that's got it, it's not a lot, but they have been paying on it for years. And
what if we raise the current premium, and maybe some of these people decide, oh, I don't really need that.
Yes, you can do that. Guardian is quoted, if they match your rate, it's $26.88 a month is what it costs. For 16 people that have it.
Yeah, it's not a premium that we raise.
Yeah.
It's a premium that
Y'all are paying that.
we're not paying it, so we don't have an option to raise it.
Yeah, exactly.
Your comments?
My grandfather, I mean, we're already dealing with this, I mean, whichever way y'all want to do it.
But eventually it
Eventually, it's going away.
Yeah.
Go away, yeah.
Okay.
And they've already got another plan for it anyway, so.
I mean, some of the 16 that's on there,
But-
had it for 20 years, the employees that Carl's got it, I mean, he's, you know.
And the thing about it is, once you don't have dependents, a lot of times that's the issue. We've had some groups like this where their spouse may have died and their kids have aged off of it, and they're still paying $1.68, thinking they've got benefits, but they really don't. Once you don't,
Well, that's for a spouse.
exactly, and
Well-
you're paying $1.68 whether you've got a spouse and no kids, or whether you've got a spouse and 10 kids.
Oh, okay.
this.
Not her.
No.
Yeah. Well, I just fixed to say, is some of the people that's on it, we might need to look at it and say, you know
what you're paying.
you know what you're paying for it, and they may want to drop it voluntarily, you know, since they're paying for
At
it.
the same time, they're doing their annual. I mean, I'm assuming y'all know, when you sit down with them once a year, you know everything that they're having taken out.
Well, y'all realize last year we did nothing with life insurance. We didn't.
We discovered all of this January 1 when we started having to take care of it.
If somebody wanted dependent life coverage, can they get it through Colonial?
Yeah, it's medically underwritten. The difference between what you're offering with the Guardian is this guarantee issue at the initial onset, which means no medical questions, no nothing. They just have to check the box if they want it. But you can buy it through Colonial, and Colonial does have different avenues like whole life and universal life. But again, all that is medically underwritten. This gives us an opportunity to buy life insurance on a dependent that maybe has medical issues and they can't get it through Colonial.
Because I think I'm one of those 16 people,
You are.
and, okay. But, you know, Colonial or y'all, somebody else may have a better plan that we could look at, and we may not want to keep that. You know, it's just something we have to look at.
Satisfying this need through the voluntary life plan that you've already
know it.
done.
But I do like the option where it's grandfathered in. Eventually, it'll eliminate itself. And then if they want to do other insurance, there's other means that this is something that the employees are paying for. So I guess, to me, that would be the best way to do it, is just phase it out over a period of time.
Okay, that's your motion?
Yes, sir.
Okay. Commissioner Fields makes a motion that we discontinue offering dependent life and that we grandfather any current employee that is taking advantage of that under the same terms.
Second.
Second by Commissioner Hockaday. All in favor say aye.
Aye.
And that's unanimous. All right.
Okay. Everything else from south of the Affordable Care Act are things that really y'all don't have a whole lot of say in this. These are things that the Affordable Care Act has mandated that groups implement. You just have to agree on what level you're implementing it. Okay? Well, actually, number 6 is really not. You currently have a supplemental accident benefit plan. So if anyone is hurt on an accidental basis, there is the $300, the first $300 of their claims are paid through this supplemental benefit. And then it's deductible co-insurance, just like a regular claim would be. We have no other plans that are like this. I've never seen a plan like this.
Tony, the reason it was done like this, we had a situation where people just was going to the emergency room for just any little thing instead of, you know, if they got hurt or a child was hurt, that's different. But I'm talking about they just didn't feel good and went to the emergency room. You're looking at probably $800 or $900 payment, And I'm going to tell you, the one thing that I really like about what the hospital has done, this new facility by Herschel's out here is going to really help that situation out, because you're going to have doctors or you're going to have nurses that can see people. There's really things that can be addressed without going to the emergency room. We put the $300 on there because we had a large expense. This way they had to pay $300 up front before they could use the emergency.
Well, it still had to be an emergency.
Yes.
Right? Or it had to be an accident.
In an accident situation, but we did have people going, saying it was an emergency to go to the emergency room, and they needed, you know, the child was sick with bronchitis or something, having a hard time breathing. You can go, in the future, when this new facility is done that the hospital's building out here, you can go and you're basically looking at a doctor pay, and that's a whole lot cheaper than $800–900 for the emergency room. And I think Tony's exactly right. We are the only people I know that have this $300.
Well, isn't that a different subject entirely, or is that the same subject? This $300 copay at the emergency room.
Yeah, this is just if you have an accident claim, you're paying the first $300 of it. It's not going to deductible immediately. The county's paying $300, the first $300.
The county is paying it, not the employee.
Not the employee.
In other words, it's a little bit of a boost to our policy in that if you have an accident, the county's going to pay for more of your needs.
That's what we have now.
That's what we have. Well, what we have to do is we either have to remove that, or we have to offer that benefit with no maximum limit. In other words, if you have an accident that costs $5,000, the county's got to pay that.
The recommendation during the workshop last week was Chris recommended that y'all remove that, just simply because it might be a can.
Sure could. An accident can be thousands and thousands of dollars. Could be.
Well, I make that motion that we remove that $300.
Motion by Commissioner, well, that we remove the current supplemental accident benefit be removed.
Right.
I second it.
Second by Commissioner Fields. All in favor, say aye.
Aye.
And unanimous.
Point number 7, waiting period. Under the Affordable Care Act, you cannot have a waiting period more than 90 days. Now, you could have it be where it is 90 days and people come on and off on the 90th day. That is an administrative nightmare for the auditor's office. The recommendation is it will be first of the month following 60 days, starting January 1.
So it could be anywhere in between 61 days and 90 days.
It starts at the first of the month.
First of the month.
It's just easier, that way you're not
Right.
waiting months.
Make that motion.
Second.
Motion by Commissioner Fields and second by Commissioner Hinton that we define our waiting period as the first of the month immediately after the 60-day anniversary to begin new employee coverage. All in favor say aye.
Aye. Aye.
Unanimous, okay.
Okay, number 8 is in regard to your out-of-pocket expenses. In the past, your out-of-pocket maximum was only attributed to your co-insurance, meaning the 10% that the employee is paying, the insurance paid 90, they had to pick up the other 10%, and this was capped out at, okay, that was your deductible and your co-insurance.
$2,000.
Yeah. You could make this be at any number that you chose to do, but I think we discussed moving it to 4,000 because you've got to add the dental annual maximum into this number, which y'all agreed to keep at 1,000.
1,200. We're moving it to 1,200.
Oh, that's right. Okay, so 12. You're right, 1,200. Okay, so you got to count all of the co-pays, all of the deductible, your out-of-pocket co-insurance, and your dental claims in this number. This year, you can establish different buckets for medical and pharmacy is talked about in number 9. But right now, this is just your medical claims and your dental claims. What will be the maximum amount? Because whatever this number is set at, anything over that amount will be 100% covered by you.
And we came up with 4,000 because we felt like that was relatively on par with where we are right now after the new definition of out-of-pocket expenses.
Correct. The suggestion was made to do 4,000 and then the out-of-network maximum would be 6,000 and 12,000. And that doubles, so it would be 4 and 8 in network, 6 and 12 out.
Right, but here's, I was talking to a couple of commissioners at the meeting. This is the maximum, but we still calculate what they pay by the same rules we've always followed.
Can you talk a little louder, Carl? I'm having a hard time.
We're setting a maximum here, but we're still really following the same rules we've always followed, so why do I family, anymore, let's say I did. And I went to I had a appendicitis, so the most I was out of pocket would be $27.50 on my regular plan. I would pay the first $2,000. If the procedure costs $15,000, I'm going to pay $2,000 plus I'm going to pay my deductible of $750.
Yes, correct. What this is counting into it though is those co-pays. Right now, co-pays have not counted towards your out-of-pocket maximum. And somebody could have met the deductible and met their out-of-pocket maximum, but their co-pays never stop. Under this plan, their co-pays could theoretically stop. If somebody goes to the doctor every day and pays a co-pay every day, they could theoretically meet this $4,000 or whatever the amount is y'all decide to make it. And at that point, they don't pay co-pays anymore.
Right, but
you're right.
But where it hurts somebody, if I'm following right, is people that don't go to the doctor.
Correct. And
we've, in the case I just gave you, let's say I only went to the doctor in December when I had the appendicitis attack, and I only been to the doctor a few times. So, for regular stuff, so I spent $50 on co-pays, $25 each trip. But now, all of a sudden, I go have a major surgery. Under this plan, would I be out $4,000 instead of $2,750?
before the claim started getting paid at 100%, yes.
I just heard a deal the other day on that very same thing. That's an Obamacare deal too, isn't it?
It is.
And they said that was a bad deal because you'll wind up paying more that way than you will the way it is.
Basically, it's an incentive for people to go to the doctor every week.
Yeah.
Because the sooner they learn.
The sooner you get to this here, you're gonna. I'm not for changing that.
Well, it's got to be changed somewhat, just to make the word comes, but I'm not sure that it needs to go. I mean, I'm following right on the out of network. We don't have our employees to still pay the first 6,000, and 12,000.
Well, that's out of it.
That's out of network.
The right network, they can be out of extra. I mean, if you've got a major surgery, you're going to go to the doctor. We've all discussed that. Then we got network right away. He did to the employee. I don't think it's not. I'm not a cancer. It's not. I just don't know. I understand what you're saying. We got to reach a number somewhere. I just don't know that it's this. I don't know that there's that big with that big. But I don't know how to tell you what the difference is.
Well, I will just say on the groups of plans we're seeing for renewing January 1, 6350 is the magic number for in-network individual. Okay? Anything south of that is y'all's decision. So just bear in mind, it's got to include deductible, co-insurance, your out the 10% that they're paying, and all the co-pays. At what point that is, again, that's y'all's decision. But in-network is the kicker. Out-of-network.
You don't have any stats that show us past year what our utilization was or average.
Well, I think Steve recommended at first 3,000, and then he forgot about the dental and stuff like that, and he suggested.
The only problem with that might is that it would have to be a situation where somebody also uses the dental that year. That dental goes too. So right now, if you went to the doctor and spent $10,000, you also went to the dentist and spent $1,200.
Talking about that.
Right now, the most you're out of pocket is
Well, that's what I was fixing to say, and I think Steve come back and I think he basically recommended 4,000.
Yeah, I think the 4 on the individual probably is pretty close to right. I just don't know if we're all the way up to 12 and all the way up to 8.
Well, it just doubles. That's just, I mean, whatever you decide, it.
Those two automatically
It doubles. Yeah.
Well, the 6 and the 12, you're looking at, that's out of network, isn't it?
That's out of network, and there's.
Well,
I mean, it's
family goes to 8.
correct. But that's all the members in your family. That's all members together.
That's the price you pay for choosing your physician.
That's a good point.
You know, when money doesn't matter, I want to go where I want to go, fine, but you will bear some of that. And the county's going to bear, and the county will bear a lot more of it, because that out-of-pocket physician is going to cost the county a whole lot more.
Well, I guess the point I'm making is we don't really have a lot of stats to know what.
We don't. We don't.
We'll know after a couple of years.
Yeah, I was fixing to say after.
And this could be adjusted next year.
I'm just saying that what I'm seeing on most plans is 6,350. So 4 is considerably less than that.
6,350, which happens to be the suggested prescription amount? Is that just a coincidence?
Exactly. Because that's the most that it can be.
In other words, we still got a real nice plan at 4 and 8. Okay, this one's a little tougher.
I'm gonna make a motion, we leave the plan as is for this coming year, and look at it next year.
Well, you've immediately cost the county a lot more money by making that motion, because they're now going to get credit for their co-pays and their deductible, which they haven't gotten before.
All that figures in.
So I think we're in agreement that 4,000 is okay for an individual, or somewhere between 2,750 and 4,000. The point Carl was making is that family maximum too high, jumping from doubling 4,000 up to 8.
Let me ask you this, and I'm just trying to get a clarification here. Say, you're looking at 4,000 on me, 4,000 on my wife. You're saying if me and her together, how does that work? I'm not sure.
The most you could be out would be 8.
Yeah, but if it's just me and I go 45.
The most you're going to be out is 4.
Okay.
If you're sick and she's well, the most you're out is 4.
Okay.
If you have
I'm with you.
The most you're going to be out is 8.
I thought that's the way it was, but I wasn't sure, and I just wanted to check on it.
Network, the most you're going to be out is 12.
And then once you've hit that, everything else the rest of the year is paid for in full.
The 6,350, was that, is that who?
Well, if you'll notice down there in the next item, we're going to talk about prescription drugs maximum out of pocket, which happens to be $6,350. But Tony was saying in the plans that they're working on with other companies, counties, entities, she's seeing $6,350 as the 6,000 is the magic out of pocket number.
Right, well, we've got 4,000, they're using 6.
So we're being real good. This is a really nice plan at $4,000. If you're not comfortable going to 8 on the family max, then that's where if any place I'd give, it'd be there. I'm in favor of the 4,000 because I think it's a fair, on-par switch from what we currently have. But did you make a motion?
If you look at it, Brian, as a per person deal, at 8, you go along with 9. What you're saying is, no one person in your family will be able to afford. And if you do have a family of more than 2 people, you're just out of the 8 total period. I mean, the third one is, there is no problem about it.
Yeah, that's the least of your problems.
So, family with 3 kids, husband and a wife both have major deals. If one of the kids has a major deal, they're not out 444, they're out 440.
Okay, I'm going to go back to you because you have a motion on the floor
I'll
right
rescind
now.
my motion since I didn't get a second.
Okay. Well, I didn't give anybody a chance
Oh,
to
you
second
didn't?
it. Thomas made a motion to leave the plan as it is, which would be richening our plan because the employee now gets credit for his or her deductible as well as their copay. So they'll meet their maximum out of pocket quicker if you like Thomas's motion. So I will ask, is there a second to leave the plan as it is right now?
Right now, meaning the 4,000 or the 2,750?
No, the 2,750. Okay. I'll entertain anything else you'd like to do. I'll make a motion that we go with $4,000 employee max and an $8,000 family max under the new terms of Obamacare, which would give the employee credit for his or her deductible and co-pays.
And the out-of-network numbers of 6 and 12?
And the out-of-network 6 and 12.
I'll second that motion.
Okay, I got a motion and a second by Commissioner Riddle. All in favor of those figures, say aye.
Aye.
Okay.
Okay.
That
Well,
passes.
I touched on this a little bit, but this year in 2014, you can have separate buckets to accumulate your medical, dental, and your prescription. So item 9 is saying that at this current time, you currently have no cap on your prescriptions. They can just pay co-pays forever. This is actually capping their co-pay amount at $6,350, but you've got to establish something this year for the prescription. And this is the highest amount that you can put on it.
Okay. Joyce, let me go back and clarify that vote. Was it 4-1? Is that right?
Right.
4-1 on that last vote. Okay. We have no maximum out of pocket on drugs right now. It can just,
They can pay co-pays forever.
But their co-pays are only $5, $50, and you have to do it now, where you can do $150. So it's gonna be real hard to do this.
but if somebody gets into those tier 4 drugs, it's
It's a possibility.
no limit. No limit.
Still take whatever 6,000.
Wait a minute. I thought drugs were going to count in that, toward that 4,000 max.
No, we're gonna pull them out.
This year, you can have separate buckets for medical, dental, and drugs. Your office co-pays count, but your drug co-pays are in your separate bucket.
It's going to cost more.
It would cost our plan more money if you let the enter out, because they would hit that 4,000 even quicker if you also let them count the prescription co-pays.
But we haven't been letting them count drug costs before, so we're not talking about making a change there. All we're talking about now is, are we now going to put a maximum limit on what the county will pay for annual drugs?
Employee pays.
I said that wrong. For the employee to pay.
And $6,350 is the most that you can, you got to do something, and $6,350 is the most you can do.
Right now, there is no limit on people.
What is, other companies, what are you looking at? What are they recommending? Our companies or businesses?
Y'all are self-funded, and the majority majority of plans that I've seen so far, they're fully insured and they don't have that choice. Okay, so on the fully insured plans, it's already in one bucket. So their drugs are rolling into that one bucket. Y'all actually can buy a year of separation by doing this, and
Well, right now, our employees don't have a
Exactly.
They could pay $10,000, it would be very, very inconceivable that happened. They could pay $10,000.
I'll make a motion that we utilize the maximum out-of-pocket prescription at $6,350, replacing our current no maximum out-of-pocket for prescriptions. So that's an added benefit to the employee as mandated by Affordable Care. Second by Commissioner Hockaday. All in favor of the $6,350 max cap on out-of-pocket for prescription drugs, say aye.
Aye.
Unanimous. Okay, thank you.
And number 10 is if the doctor will write you a prescription for an over-the-counter medication, it would have basically no deductible for preventive things like aspirin, vitamins, but the doctor's got to write a prescription for that over-the-counter medication. But again,
Is that a requirement?
if it's not a requirement, but they're suggesting that you do it because it is in that suggested list of things that.
Well, it incentivizes that employee to take a drug that's going to keep him from getting sick.
Correct. The only bad thing about it is that they've got to go to the doctor to get the prescription, and that's going to cost $25 to get it. So there's probably very few people that are going to go to the doctor to get a prescription for aspirin or for vitamins or whatever. But if they do it, and then when they get it, then they can take it to the pharmacy and it's free.
And I gave you the example of me taking Zyrtec daily to avoid allergy problems, and you said that's not good. Why? Why is that one not?
Because that's not a preventive.
So they defined that list, is what you're saying?
Yes.
Okay.
Yes.
And aspirin's one, vitamins one,
Vitamins,
birth control's not one.
No, that's
That's not preventative. That's a joke. Okay, well, I think that that's a good deal. I think that if we can get somebody to take a relatively inexpensive medicine, it sounds like, we pay for it all if it's going to keep them from getting sick and costing us more.
Good example was baby aspirin for people with a heart condition.
Yeah.
When you take a little baby aspirin a day, rather
Yeah.
than you
Save.
pay $1 for it, then the county's going to pay $1 for it.
Okay. I'll move that we put that as part of our plan, that preventative care drugs, including over-the-counter, would have no deductible if the doctor provides that prescription.
Second.
Or that over-the-counter, or a prescription for over-the-counter preventative medication. Second by Commissioner Hinton. All in favor, say aye.
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 Opposed, and there's none. Okay.
Okay, now this is your point from the previous statement. Women's contraceptive is covered at zero cost to the employee. You do not have to do men's contraceptives, you approve this, it is women's only. And that is something that, again, that's listed under the preventative benefits of the Affordable Care Act.
And what options do we have here?
I don't think you have.
I don't think we have any.
The option is not to include the beer, I think.
Exactly.
Oh,
That's the only
okay.
option in it.
But you want to have.
Okay.
I make that motion.
Second.
Motion is to zero cost to the employee for women's only contraceptives. Okay. Second by Commissioner Fields. All in favor, say aye.
Aye.
Unanimous. Okay.
Okay, preventative vaccines covered under the RX benefit, whether at the pharmacy or doctor's office at zero cost to participant. This was kind of what we talked about with the shingles vaccine in that last discussion, but this would be for any other preventive vaccine like meningitis or other types of preventive vaccines that people take.
Flu shot.
tetanus, I mean.
Flu shot.
Well, yeah, flu shot would be whether, but you got to determine, your choice was whether at pharmacy, you could have chosen only at the pharmacy, only at the doctor's office, or both. Their recommendation is to let them get it wherever, pharmacy, doctor's office, wherever.
I think the cost is about the same, isn't it?
It's just a matter of convenience. Sometimes it's easier to get to a pharmacy than it is to a doctor's office.
Does the doctor have to give a prescription for it if they choose to go to CVS?
I don't think so.
I can go get my flu shot at CVS or at the doctor's office.
What we're doing now on our flu shots, we order them, and then we have a nurse that comes give them to everybody in the county.
Yeah, that's right on that one. But
Would that pay for that, or what, how would that work?
I would assume so. If you choose the option that allows you to get the shot at any location, as long as.
well, we're paying for it anyway already.
Yeah.
Yeah, we're paying for those anyway, yeah.
Okay.
Well,
So is there anything to decide on that one?
Yes, you gotta say it's okay to get it anywhere.
Yeah.
Or it's
Yeah, doctor,
okay to get it.
pharmacy, or.
Okay, I make a motion that we include in our plan preventative vaccines covered under the prescription benefit, whether at the pharmacy or doctor's office, is no deductible or zero cost to the employee.
Second.
Second by Commissioner Hockaday. All in favor, say aye.
Aye.
Opposed, and there are none. Okay?
Judge, there's one thing, the thing about it over there, pretty well, we have probably, close to 95% people that get their flu shots and stuff because it's convenient to do that. I don't know what we need to do, but I would encourage all county employees to get their flu shots.
And we haven't been notified yet that those
They
vaccines
said
are
as soon
in.
as they get in, James is waiting on the call, and once they will set a date up and we'll do it over here.
Do we offer family members the shot here at the county?
Family can come
They pay
get
for
it,
their
but
shots.
it's $25.
It was 10 last year. Well, I don't know what it was. They pay for them, whatever it is.
Yeah, the spouse or the children or family pay for their flu shots, and the county pays for the
They pay them
employees.
when they get it.
When they get their
to the
shot, they
nurse.
pay
She
for
takes
it right
back
then.
to whoever, we get them from Riker.
Okay.
And I think that's about what it costs, Judge, at Walmart or pharmacy or whatever. It's just a convenient deal.
Did we vote on that?
Number 13 is already been taken care of, thank you.
Did we have a motion?
Did we vote on item number 12 to allow preventative vaccines? Okay.
Yes.
All right, and item number 13 was to define separate out-of-pocket maximums for medical and prescription. We took care of that.
That's
All
8
right.
and 9, yeah.
Before we look at or discuss anything in green, was there anything else we need to decide today?
I think that gets it done. So I'm assuming that y'all are renewing your current contract with these changes. That's the only thing that.
I will make the motion that we renew our current coverage with the changes that we've made today.
Second.
Second by Commissioner Hockaday. All in favor, say aye.
Aye.
None opposed.
We have enrollment already scheduled for middle of November. We'll distribute, talk to Christie already about giving information to employees in advance so that they have information to look at prior to that enrollment meeting. I think that will help with questions at that point. If they have questions, call us before, and that way we can go ahead and have a speedy enrollment session.
Great.
And these changes and stuff, when we have that meeting, and I think it's set up for the 23rd, is that right?
No, sir, it's
Which one are you talking about?
That's retirement 10.
Okay, that's retirement. Okay.
The enrollment for the medical and life, that's November the
18th, 19th, and 20th.
Okay.
Now, we have a retirement meeting that's between 23rd.
Okay.
Question?
Yes, I have a housekeeping item. If you voted, you have voted to make eligibility first of the month, you also need to make termination
That has already been.
Yeah, we're already doing that.
In other words, if somebody quits on the 7th of the month, they're covered till the end of the month? Okay. All right, do you want to discuss today any of these items in green?
Judge, we're looking at doing this. When are you looking at discussing it?
Well,
maybe making
it'll
a
never
decision
get
on
done if we don't discuss it and vote on it and begin to notify those affected that we're considering doing it. Let me just review these if for no one else other than for Al's benefit. We are currently talking about the benefits that we are offering to our retired employees. Those that are currently retired currently receive benefits to 65 years of age. There are 6 total retirees that are affected by this. Are we going to continue this, or are we going to discontinue this? I believe that the consensus has been that we want to, at some point, discontinue this benefit, but we want to pick a fair and equitable way to allow this to fade away rather than just cutting it off right now and taking away benefits from those that are our current retirees.
Well, I don't know, Ryan, if we want to discontinue the total. I think we just wanted to. Right now, we have no age requirements at all. Most of the other entities do have age requirements. The city, you have to be 58.
What we had talked about was that future retirees must be a minimum age at retirement, rather than somebody like, in Christie's case, you could retire at 49 years of age and thereby have 16 years of fully paid health insurance by the county, which Carl says that was never really the intent, to reward somebody that retired that young, but nonetheless we have that as the case. And so I would guess you're probably the youngest individual that could be impacted by a decision. Okay, well, and these are the people we need to think about when you're making this decision is you know, are you now going to tell them that they have to be 50, 52, 4, 6, 8, 60? What do they have to be when they retire so that you don't run into this situation?
The other part of it was that in a lot of instances, they can retire at 49 from the county. They may or may not retire from the workforce. So they might go to work for another company, but instead of getting on that company's insurance, they stay on our insurance because we're not able to track them. We don't know what they do when they leave here.
Yeah, and it's probably superior coverage, and so it would make sense to say, I want to keep getting that good county coverage.
And the other critical point about that is because we were self-insured, we're not just talking about
Premiums.
we're talking about if they had major medical problems anytime during those 16 years, the county could be out hundreds of thousands of dollars, not just the premium payments on their insurance, because we are self-insured. If they had cancer problems that started when they were 55, after they retired for 6 years, that cancer treatments might last for 10 years. We might be out $100,000 a year every year for 10 years on that. Well, maybe they were working somewhere else when they were 56 and they could have been on their insurance.
Well, what would help me make this decision is if I had a list of everybody that would tell me at what age could they retire. That may be a chore to put that together, but before we go making this decision, you need to see who's impacted and how many, if any, you're willing to impact.
I'll get that list together for you. I would think we wouldn't want names. You just want numbers.
Okay.
I'm gonna tell you one thing, this is gonna be a cost,
It's going to be a huge cost.
huge cost.
And that's what we're trying to avoid, but at the same time, we want to be fair to those that have put in years of service before you just yank something away from
And I
them.
understand that, but in the same sentence, you gotta be fair to the taxpayers too, because that's gonna come out of their
And I think
pocket.
we can find a balance, and I think we can start.
I think we need to, when we did this, we thought 60 was gonna be the minimum of this retirement thing. And now it's turned out to be, it's gonna be people in their early 50s.
And so if we can find a way to stair-step that, if we started it, just as an example, started at 50 years of age or 54 or whatever, and then increase that each year so that you're not punishing the existing employees that have worked here and counted on this, but you establish a precedent for those that are still in their early years of employment here. Yeah, in other words, in 2014, you must be 54 years of age. That was my suggestion, 54 in 14. You got to be 54 years of age if you retire in 2014, 55 the next year, 56 the next year, and so forth until we hit a maximum of, say, 60.
Yeah, I don't know that I'd be comfortable with 54. I'd probably be more 56 or 58.
Yeah, well, let's get a look at this list of employees and see who all were, how many people we would be affecting.
That number is going to be constantly changing because you've got lots of young people coming and going at the sheriff's office.
You will probably have.
But I'm not as concerned about affecting that new employee that's been here a year or two, that's a long way from retiring, as I am the guy who's put in.
I'm assuming you want me to give you a list that shows a picture of the 120 employees we have right now, what the retirement age of those 120 would be.
Maybe if you had a list of 5-year employees with 5 years of service or more.
I don't know about that part might be hard to do, because I don't know if we've got anything tracked. I mean, I know I can do it by looking at each one and seeing when they started.
Right, I mean, we'll have a report that has their start date and it will print out, that we'll have to go through. It's not saying I can just push the button that says, give me the people.
I know you can't. And
But I mean, we can do it, it'll just take a little bit.
but before we make a critical decision like this, I think we've got to have that information. We need to know how many people we're potentially affecting.
How many people we're affecting here.
Yeah.
Also, and I think Carl brought this up, if you retire at 52 and you go to work the next month for Bill Preifert out here and he offers insurance, do they have the option that once they take that insurance, they're all county insurance, or, I think we need to make that decision too.
Okay.
Well, the problem that's going to be, I don't know how to know where they went to that here.
Well, that's pretty simple, Carl. We just tell them, you fill out, you contact us yearly, or if you change insurance, you have to contact us. If you don't contact us after a year, you're dropped. It's there,
The easiest way is we have a yearly enrollment for
Right.
medical anyway, so they have to be poured in with the employees as well, so they can bring proof of employment or.
Yeah, I would need to check with John Mark. I'm not sure what I'm allowed.
to do.
I'm going to say, you may not can do that.
I mean, send us that, bring me a copy of your tax return, but I don't know that I can require that.
I don't think so either.
Chris?
Well, if they're using the insurance company's going to have contact data for that person if they're using the insurance. I mean.
Well, yeah, I can get a hold of them, but that doesn't mean that, I can track it down.
They don't have to tell us.
But they don't have to.
We don't know if they're working somewhere where they have insurance available. Let me ask you this. I don't even know the answer to this. If somebody retires from here at I think I just answered my own question.
The policy was originally the plan for people that when they retire here, they will retire. And we would continue to provide their insurance. And that's what the cities is. That's why they've got 58 as the age. They're assuming when you get to be 58, 60 years old, and you retire, that you really are retiring. And so we were going to provide their insurance until they reach Medicare age. They're not.
And we looked at 60 is what we always thought about, was going to be the retirement age.
It's not true anymore.
No, that's necessarily worked out.
You can have 30 years, I mean, I can have 30 years at 49.
Yeah.
Yeah, and I'm not sure she should be punished for that.
But I'm not going to retire at 49.
Write that down.
Most people cannot afford to retire at 49. First off, based on retirement calculations, because you're only 49, the amount of monthly benefits you don't get from the retirement system is not going to be very much compared to your salary.
55 is my magic number.
So, they're not really going to retire. They may retire and start drawing their money again.
Well,
But they're going to need something, they're going to need to work somewhere else unless they're willing to live on 1/5 of what they were living on before.
that's,
Yeah, but you give Christy the option of going and finding, and I'm going to go work in the private sector and make some good money, but I'm going to take my county insurance.
that's right.
And the other option that we can consider is, okay, we'll leave you on the insurance if that's what we want to do, but you're not going to be on the county self-insured plan. We're going to buy you a Blue Cross Blue Shield so that we know what our cost is.
Yeah,
I just heard the other day, where one state, if you could get on Obamacare, Blue Cross Blue Shield won't take you. They will not take you, and that, whatever, I don't remember what state that was.
No, the way Blue Cross is working with the federal exchange and the private exchanges, Blue Cross is going to be playing in both markets. If you qualify for a subsidy, then you are on a plan that Blue Cross has filed with HHS. If you do not qualify for a subsidy, now that's based on your income, then you qualify for a Blue Cross plan that is in some ways very similar to those plans, but there's more plans available to you. That's the way it is in Texas. There's a lot of stuff going on that's not about the way Texas.
This wasn't Texas, this was one of the northern states, and they said that Blue Cross would not take you.
Well, Blue Cross is different in every state.
Yeah, well, yeah, that's true.
So, but that's the way, because we're already ready to look at rates,
Yeah, for Texas.
for Texas,
Yeah.
Virginia.
you were wanting to say
Yeah,
something.
no, did you say that Blue Cross is one of the exchanges? And they are.
Yeah, they are.
So that's they're one of those people that support it, because they're going to be.
Well, there's probably others. There's Humana, there's Aetna, there's probably 15 different carriers in the state of Texas that are participating on the federal exchange.
Oh, okay.
But,
Blue Cross is probably the biggest.
Well, I don't know.
Well, along this same line, we're also covering the retiree's spouse
I think that's something we need
at
to-
our dirt cheap spouse coverage rate, which is another huge exposure.
Although
And their children?
typically they won't have dependents.
Yeah. No, not children. We do.
That's not true.
They could have
I got some grandkids. He's 50, he
Well-
got 1/6.
So that's another factor to consider. Are you going to allow just the retiree to continue coverage, or are you going to continue to allow the retiree and his spouse, her spouse, to be covered?
I think we want to do away with that spouse, period.
Just yank it right now, huh?
Well, we're sitting here arguing about saving money, and we're talking about something here.
I agree. I totally agree with you. It needs to be, both sides need to be discussed.
When you retire, you should.
And there again, if we knew how many people we were potentially affecting, it would help me make that decision. If I can find a sweet spot in there where it's not going to be a huge impact.
I don't think, to me, there's not a sweet spot. You're either going to hurt somebody or you're going to make it equal for everybody. I don't think there's, to me, there's.
There's got to be something said about loyalty,
It's going to hurt.
Chris?
And that's not the thing. If somebody's retired, they gave you 30 years, what are you giving back to them? You're not giving them anything. And if their spouse does have a pre-existing problem,
They're not gonna
and
be-
you drop them, they're not going to get that
That's not
insurance.
true.
And they're paying the premiums, and they're paying the premiums anyway, when they retire for their spouse. So.
At a greatly reduced price, though.
Greatly reduced price, and I think we gave them a good plan for all those years, so,
What would be my incentive for staying here for 30 years?
The longer you stay, the more retirement money you make.
how much you
But
get.
you just said I would only get a quarter of what I would make if I
No. they do on the calculation is they look at the fact that you've been there 30 years, but if you're only 49, they expect you to be drawing that money for about 30 or 40 years.
Yeah.
If you're only 49, they expect you to live till you're 85. So the amount they're going to give you is not going to be as much. If you stay till you're 60, you probably can draw your salary.
I can draw my salary more at 55.
So the longer you stay, the more incentive
But
there
that
is.
is her decision to make. If she decides to retire at 49, she's put in 30 years. That is her personal decision because she's been here 30 years. There's not a lot of people that will work in one place for 30 years and walk away and get nothing.
Well,
And I see that, I understand that, I understand that I can make more money the longer you stay. But if somebody's young and has the opportunity to go on ahead after 30 years of working someplace and making more money somewhere else, that's their prerogative. That has nothing to do with any of your decisions. They gave you 30.
That part is correct, and they're still going to get their retirement after the 30
That's
years.
right.
But what you're also saying is now, in the next 16 years, if I get sick, I want the county to pay all my medical bills.
And why shouldn't you? We gave you 30 years.
Well, hell,
And if I decide to
You
go
gave
get
me 30
another
years and
job,
I paid you every day for those 30 years.
if I can,
You
you offered that to me when I got the job. You offered me
Well,
when I
that's
got the
changed
job.
all the time. People's pay rates change all the time. Those people that work in buildings.
Okay, so again, it goes back to loyalty. That's what we're talking about. We're talking about dollars, and I can agree with you on cutting dollars, and yeah, that's gonna cut a lot of dollars. But what about loyalty? That's what people are looking for when they work for you, is loyalty. You expect that out of your employees. You expect loyalty out of them.
Yeah, you know, and I hate to be harsh on it, but I think that as long as you work here, we got a good program while you're working here. I think that's part of what we give you for those years that you work. If we furnish you a good health program and a good retirement while you're here. And to me, I don't think we're supposed to take you from birth to death. And that's kind of what that does. If you retire at 49 years or 50 years old, that takes you from then to death, you know. And we're taking care of you. And that's, you know, that's a little harsh to say, and I don't mean to be harsh. But I'm going to tell you, the people out here that pays the taxes, that pays our salaries, they don't feel that way. Because I hear it every day.
But when you get older, you start getting sicker.
I understand that, and I understand that, but I'm telling you, the people that pay the taxes don't feel that way.
And I understand that.
And I hear that every day.
I'm talking about there's, you know, somebody who puts in 30 years, I'm not going to be here 30 years. I've been through the TRS, you know, all of that a long time, but I can tell you I'm not going to be here 30 years, and I'm not going to walk away griping about anything,
Yeah.
or any benefits that I have. I appreciate them. I'm talking about the very few that give you 30, 35 years, or 30 years, and they have that option because they gave you 30 years. I just
You know,
feel like that's the loyalty part, and that's the free money that should be given that person for that dedication to their job.
And I understand that.
could I ask you a question? What did you do before you came to work for the county?
I work for the district.
For who?
Driving compensation. District.
District Attorney's Office. No, same.
Oh, here in Mount Pleasant?
No, out of town.
College Station.
Out of county. At where? College Station.
Right.
Are you eligible for insurance there or retirement from them?
I have the option of continuing their insurance, and it was a lot better than this insurance.
The only
I would have had to pay for it too.
Yeah.
So there's an example, if I would have chosen to.
Thanks, Tony.
I can retire at 59. If I choose to retire at 59 and I decide to go get another job, I can tell you it's going to be hard looking for another job other than at Walmart for somebody who's older. But if the insurance is better, I'm going to take their insurance.
Well,
So that's me.
Well, that's
I mean, I'm not saying that everybody would do that, but I think somebody with common sense who can get into another job that has better insurance than what you guys are offering, they're going to take
Well, I hate to be the bearer of bad news, too. I feel just exactly like Thomas. We all want to be like Santa Claus. We like to give as much as we can to the people we work for and our friends and family. But there becomes a time when you can't do it. You know why my wife is working? For insurance. That's not fair. She shouldn't have to do that. I mean, I could say that, but I thought Obamacare was going to take care of that anyhow. He's going to insure everybody. I couldn't more disagree with you at all, because I don't think when you retire, you make that decision. You want to stay here and work and draw the salary, but if you want to go into business yourself, start painting houses, and I know a lot of these retirees that are young are going to do that. That's their privilege, but I think that taxpayers should not be obligated to keep paying them. I disagree with you, and like I said, I hate to be the bearer of bad news, but that's just, I think it's wrong.
Well, you're talking about 6 people right now.
And some spouses.
Can't answer that question.
And sometimes you don't get elected again.
Yeah.
Well, that's right. If I had my way, we'd have term limits anyhow. But I believe it creates a problem being re-elected time and time
My
again.
request of whatever the court decides to do is give the employees plenty of time that it's coming. I'm not saying, you know, if you're gonna make whatever you make it, but don't make it today and tell them tomorrow. Kind of like look at it a year from now, 6 months, so they can kind of get in their mind, get ready for what's coming, whatever it may be. Just don't surprise attack.
Well, it's one thing to tell a 3-year employee that this is no longer our plan than to tell a 25-year employee.
That kind of give them some time to digest it. You know, the new employee that starts today, they don't have, you don't have to worry about it for, but it does give them some kind of, go ahead and do it, but kind of give them some time to solve it.
Well, we need to have this in place by January 1.
No. We can make these adjustments anytime. We pretty well decided the other day that we were not going to make any changes because we got to have this plan going next week.
Okay,
And these, since these were the tough questions, we can start talking about these, and we can even implement it for January 1/15, letting everybody know, so that especially. So all new employees know what the deal is. All employees 5 years or newer know the deal, and then you pick a point where you say, okay, you guys, we're bringing you forward under the same terms. And you just got to find that balance. What?
So what you're going to have is everybody working till 65?
No, we're talking about a mandatory retirement minimum of, say, 60, for example, not 65. We're not talking about stripping away this benefit altogether. We're talking about not making it available to the 49 or 50-year-old that decides to leave.
And you might, instead of using 60, you might use what the city uses. The city uses 58.
This rate is
So you cover them until 65?
Right.
Yes.
But
Yes. But we would try to get the plan back to what it was originally intended to be, which was, well, everybody retires at nobody retires at less than 60, but that's changed. And
I'd
so
just soon get all this done today and be through with it myself.
Well, we're going to have to do census as
I
far
can't.
as y'all want to see how many you're looking at. That would give us,
I don't mean,
unless you're going to bypass that.
Well, I want to see that list of employees and who I'm affecting.
I'd like to see how many people is going to be affected here, and I like the stair step
That
till you get
minimum retirement age.
till you get to that minimum retirement age. Because I know, talking with Tim, and he was talking about training people and you work with them and stuff, and talking about salaries, and that's the reason we've been trying to gradually redo some salary structure down there to help compete with the city and the state and the different people in there. But he says you don't realize how much money it costs to train somebody, and then they decide they can go somewhere else and make more money. And this is one of the factors you're going to be involved in here. You're going to have people out here that works for the county, and somebody's going to come up because they do a good job up here, and they're going to come up here and offer them more money. The benefits is one of the things that keeps a lot of our employees here and not take other jobs. And I understand that, but to get good quality people, they pay for themselves. Good people pay for themselves. Good workers.
But you're talking about sheriff department, they're not gonna have any, they got very few that's gonna be there long enough to do that anyway.
Well,
That's the biggest turnover.
that's not really what they do, Thomas, is if I'm right, when they work for our sheriff department, they're gonna stay in law enforcement.
Yeah, somewhere, but they don't stay down here now.
So they stay in the retirement system. It's just a matter of which
Somewhere else.
county they're in.
But they're not gonna be on our insurance plan.
That's why you kind of want to be as uniform. I mean, if the city's 58.
We are, that's what we ought to be, yeah.
You know, ideally, all counties and cities have the same number, then there's no difference between which place you're working at when you retire. Those guys all stay in law enforcement, they work inside that same retirement system wherever they go generally.
But there's two different things we're looking here. We're looking at the retirements, and then we're looking at retirement with the medical, where you have to be here 12 years, and then have the rule of 75, or whatever rule y'all make it, so you can retire.
It's 8 years.
Retire.
It's 8 years. It's 8, it's not 12 anymore, it's 8.
But y'all made it for 12 for medical. Yes, age you can be vested for retirement, but it's medical, you have to work here 12 years to
I
retire.
don't think so. I didn't think so.
It is different.
I don't know.
The 8.
And we made that? I thought.
I think it's 12.
Yeah, it's 12.
Yeah, I think it's 12 on the
12
medical.
On medical?
I think that's what I thought.
Y'all bumped it up for-
I haven't seen it in writing.
Only with the retirees. I can retire at 49 and be gone and do whatever I want to, but I'm not going to get, if y'all choose to make the rule 58 and I want to go at 49, I can still go on my retirement, but I'm going to go get somebody else's insurance. That's two separate things we're talking about.
Well,
completely
Mr. Fields
confused,
says that
So what you're
employees
trying
are
to do-
good assets, and that's true. And the good asset is they should stay working at 49 because they're good employees and have a good insurance policy. And if they retire, they won't have it. That's the incentive to
Well-
stay.
You're not going to have many people retire at 49 and not work anymore. They're going to go to work somewhere.
Yeah, that's right. I know some people planning on retiring, and they already have an occupation and jobs lined up. And I'm new, and I already know people, and I can't blame them. So especially if we're going to continue the insurance, I think there's a hole there somewhere.
Let me throw out the last uncomfortable subject, and that is if a spouse can be covered by their employer's plan, we had talked about making that spouse ineligible for county coverage. We talked about this a year ago. I sent out a notification to department heads and elected officials. I think I got 3 responses from employees saying what a bad deal that would be for them and how it would affect them because their spouse was working at a place with inferior coverage, more expensive coverage, several different reasons. But that is...
This was part of the benefit that employees were told they could have, and with the spouses, I think we need to, if we're going to stair-step it, we need to do the same thing with the spouses. You've paid all those years for your spouse. This is not like somebody come in the last 2 years and put their wife on county insurance. If they've been paying now, if you just put your wife on there.
This is two different questions. You're talking about if they retire for your spouse.
Yeah.
I'm talking about their spouse.
I'm not talking about a retirement situation. I'm talking about if I come to work and my wife is working somewhere and she's offered benefits, health benefits, but she says, no, I'm going to tack on to Brian's plan because it's a lot better and it doesn't cost me $500 a month.
And I'm gonna tell you that happens, because that happened in my.
Well, sure it happens, because we've got a great plan.
Because she worked for the school and it wasn't.
But now with the Affordable Care Act, at least if somebody's working for an employer with coverage, it's going to be better coverage.
The cost is going to be the deal because our cost is still relatively low.
Yeah.
Or with spouses, 40 paychecks, so 280 for spouse.
$289
What a deal. What a deal.
Most people, that's a cost of $4,500. Problem.
So those are the,
You're saying if the spouse is working and they have insurance, they get it. What if they don't have insurance, and what if the spouse is not working?
They can stay on ours.
They can stay on ours.
If they're not working, but if they're working somewhere, they go on
They got
that
insurance.
whoever they're working's insurance.
But what if they don't offer insurance?
that's not the question here.
I don't think that's part of
They don't
it.
offer insurance, and they can stay on our insurance. Again, the problem's going to be is enforcing that, and I don't know how, other than the honest, I don't know how,
You sign a piece of paper that I will notify the county if my spouse becomes eligible for insurance.
but again, that's the honest.
Yeah. Okay, well,
Spouse works in the school district, and was eligible for school.
so I'll schedule a secret Commissioners Court meeting for these then.
What did you say? You gonna do what?
I'll schedule a secret meeting where we can vote on these. Okay, well, if you'll work on getting me that list, I mean, there's no rush on it where we could see who might be affected by this. And we'll postpone these off till another time, but these are heavy decisions here. We don't want to take them lightly. All right, anything else? All right, thanks for your time this morning.
I will say one thing. If you're traveling on 49 and 2348 to New Road, I just had another bad wreck out there this morning. It looked like about 4 cars, or I don't know how many. I know it's 3.
Was it on 49 or 2348?
I don't know where, yeah, at the light. I don't know, there were cars in both directions, so there was some on 49.
But it was at that intersection.
It's at that intersection where the new red light is. I know it was 3, I saw 3. And one was down 2348, and one was on 49, and it was another one sitting on 49, so I don't know.
That's two they've had this week, I know.
They had all,
2 this week.
they had one Saturday, I understand.
Saturday, they had another one Wednesday, I think.
Okay, I'll make a motion to adjourn, second by Commissioner Fields. All in favor, say aye. Aye. Okay, Monday morning, 9 a.m.